One of the reasons I was initially drawn to Mount Sinai was because of its diverse population. You really are in the heart of New York City. You're seeing patients from all different cultural and ethnic backgrounds, and you really have a wide variety of subspecialists, particularly in pediatrics. You really have access to all levels of care.
Our principle is to provide complete care with a team approach. We are an incredible team of faculty, nurse practitioners, medical assistants, social workers, and nutritionists, along with a dedicated administrative staff. With this support, it means our fellows are focused on learning and improving clinical skills.
What we're looking at are disorders of hormonal imbalances in pediatric patients. So we see a large patient population with diabetes, both type 1 and type 2. We also see patients with thyroid abnormalities, patients with puberty disorders, patients who have issues with growth, so either being too tall, too short for their age, and we typically follow them long term. Once they reach adulthood, we then transition them to adult care.
We have been in the business of graduate medical education since 1924 and currently support an outstanding categorical residency program with a robust research track, 2 combined residencies, triple board and med-peds, and 12 pediatric subspecialty fellowship programs.
Although Mount Sinai Kravis Children's Hospital is physically located on the Upper East Side of Manhattan, the department reaches into every corner of the Mount Sinai health system, one of the largest in the world.
Having Mount Sinai's reach of hospitals out into the outer boroughs, we are also seeing an immigrant population that may not necessarily have been diagnosed early on prior to symptoms being developed, and we are still seeing some of those rare cases that you may not necessarily see in other institutions.
The hands-on experience here not only prepares you for any clinical setting, but opens doors to innovative research.
You get to pick what field of research interests you. For my primary research project, I'm working at the Diabetes, Obesity, and Metabolism Institute here at Mount Sinai.
At Mount Sinai, we emphasize a highly collaborative research environment. Multidisciplinary work is our norm. Translational pediatric research includes investigators in the departments of psychiatry and genetics and genomic sciences, as well as more fundamental studies in the cell, developmental, and regenerative biology department.
The primary focus of my research is to develop future therapies for people with both type 1 and type 2 diabetes, with the hope that eventually we can find a cure.
I am proud of the recognition of a number of our 15 subspecialties by U.S. News & World Report in its Best Children's Hospitals rankings, and of our research support from the National Institutes of Health that places us among the top 15 departments of pediatrics in United States medical schools.
My fellowship program has definitely exceeded my expectations. There's a great sense of community. Even though we're a pretty big academic institution, you still get that small family feel from working here. You can really get a sense that everyone's really dedicated to your learning and making sure that you become the best physician possible.
Mount Sinai is dedicated to being your roadmap to becoming an expert in pediatric endocrinology. We're excited that you're considering becoming part of the team that sets the standard.